Okay. Looks like we've got people coming in quick and fast, so we can go ahead and kick off. Good afternoon, everyone. Great to have you all here. For those who don't know me, you won't have seen me in at least a year. I'm Alex Cobble-Chantren, Medtech's Clinical Integrations Product Manager. And today we have with us, we have Al Duncan, who is the Client and Partnerships Director at Webtools, Bridget Holland, who is the Head of Marketing at Webtools, and Kirsty Vester, who is the Medical Center Manager at the Doctors Newlyn. Today, they're going to be chatting about Webtools' new Centrik product and their experience implementing the new Doctors app, which integrates with Medtech seamlessly via Medtech's new standards-based integration platform named Alex, not named after me, I promise.
Who's it
As you
named
come
after,
across,
Alex?
it's named after our CEO's wife, who incidentally is also named Alex, but it's not me. As you come across questions throughout the webinar, please feel free to pop those into the Q&A box at the bottom of your screen. And we'll get through as many as we can before the end of the webinar. And any questions that we do not get through, we will make sure that we get contact details sent through at the end of the session. Also, for any who have any colleagues who were really interested in attending, but for any reason couldn't participate or weren't able to attend, we are recording the session. So we'll be absolutely happy to pass along that link to anyone interested. So you're not here to hear me speak. So without further ado, I will hand off to the folks who we're actually here to see. So take it away, Al.
Kia ora, everyone. My name is, as you heard, is Al Duncan. I work for Webtools. I'll hand over just briefly to Kirsty to introduce herself too. I can't see you, Kirsty, but are you there? Can't hear you, Ed.
I believe we had her just before.
Yeah, we saw her before.
I saw a wave.
She's still online there. Let's just see if we can get her microphone going. But in the meantime, I'm going to share my screen. Before we kick off, I would like to thank Medtech for putting together these Alex webinars. They are highly valuable. It's a great opportunity for us all to kind of get together and to get into a little bit of detail about some of the innovations that are coming out in the sector, especially in this interoperability space. And with third parties like Webtools being able to come in and actually start to do some of the cool things that we're good at. I'd also like to thank Medtech for hosting me. I'm up in Auckland today, so I'm actually right next to Jeff's office. The lighting in here is terrible. I have got hat here as well, so I'm looking a little bit ghoulish and a bit dishevelled, but I won't let that put you off. I'll share my screen and we'll kick into some slides. I would like this to be kind of run in a bit of a casual fashion. I've got a slide deck here. When I share the slide deck, I can't really see much of the audience. So please don't hesitate to just chip in if you have any questions or if you want to interject. The idea here is I'll go through a little bit of background, a little bit about the integration, a little bit about the journey we've been on with Green Cross. I'll hand over to Kirsty to talk a little bit about her experiences with implementing the Doctors app specifically for Green Cross Health at her practice, the Doctors Newlyn. And then after that, if we have time and if there's interest, we can actually dive in and do a bit of a product demo as well. But I'd love to leave enough time, like plenty of time for Q&A. What I've experienced in the past is whenever we've talked about what we're doing, either on the tech side or the implementation side, there's been a heap of questions. So I'd love to leave plenty of time and space for everybody to dive in and ask questions as they come up. So like I said, don't hesitate to interrupt at any stage. I'd love to hear some voices, otherwise it's going to be a bit of a monologue. I'll just dive straight into here. I don't know if you know much about Green Cross Health, but we've now partnered with them. They're an excellent partner. They've got obviously the doctors side of the business, the medical division. Here it's a little bit out of date, but they're I think now at 61 practices and growing, with knocking on nearly 400,000 enrolled patients now. And they also have their pharmacy vertical, which has I think over now 360 pharmacies across their life and Unicare brands. This for us as a tech company and our partnership with them presents a unique opportunity whereby rather than just connecting and working directly with general practice, it opens the door to working across healthcare providers with the pharmacy arm of the business, which I'll touch on in a little bit. A little bit about us. Webtools, I always like to describe Webtools as my happy place. I've had a long journey in the last 15 years in health and in health tech. And I joined Webtools about 3 years ago. My background is actually not in tech. I've got a master's in public health, and actually in epidemiology and infectious disease transmission, interestingly enough. But I got into the health tech space because I really thought it was an opportunity to make a difference. And at Webtools, that's what we're doing now. And we really care about our team. This is really our point of difference, and why I love it so much here is we care about us as a team, we care about our partners, and we really care about our vision, which is this frictionless technology for happier, healthier humans. So collaborations care what we do, which is why we partner with the likes of Green Cross. We partner with a bunch of other groups as well, but I'll specifically target Green Cross today because we've got Kirsty involved, and we'll talk use cases with what we're doing with the Doctors app. Someone wanting to interject? No? I'll crack on. So, I mean, the first question is, why do we want to do this? You know, we know the context in primary care currently, and it's been this way for a long, long time, around challenges faced with the workforce, with access to being able to access your general practitioner or access healthcare services, being able to work across service providers, being able to share information and access information, and know what services are available to you. So what we're trying to do here is both from a patient point of view, is to provide the information and the tools and the access using technology to help them manage their health and well-being. And on the provider side or practitioner side, it's no different. You need the tools and you need the access to the patient information at the point of care when you need it. And we know it's hard. Analog is still commonplace, paper and pen, having to repeat yourself time and time again, and from a patient point of view, when you're moving across service providers and having to repeat the same answers time and time again. There are a bunch of inefficiencies, and I've actually just dug into general practice funding and lifted the lid a little bit on that. I knew a little bit about it, but I spent a couple of hours with a very experienced practice manager around some of the challenges facing general practice around the streams of funding and the claiming for various services through all the different streams. And it is incredibly challenging. It's just one of the challenges faced by general practice. But all of these challenges make life frustrating and make the whole context quite challenging and costly for everyone involved. There has been, historically, there have been a lot of technology barriers. There's been a lot of legacy tech in health, and actually outside of health as well, and other sectors, but health seems, from my experience, to be really quite a long way behind, and particularly in patient-facing applications and modern mobile technology. Systems historically have been wedded to each other. So, for example, with patient portals, they've historically been created by the practice management system vendors themselves. So there's a one-to-one relationship between a patient app and a practice management system. The vendors have tended to call the shots around what features get developed and when they get developed, and how often releases come out the door. There have been a lot of multiple systems and licenses and brands involved in the sector. So this is from kiosks to practice management systems to online booking systems to SMS systems. It's nothing probably new to you all in the audience coming from this space. Is each of those provide a different user experience when you're coming from the patient side of things, and it has created quite a disjointed and confusing workflow or interaction or experience for patients. From our experience implementing the Doctors app and our Centrik app across general practices, there has been historically very poor uptake in the previous patient portals, and as a result, they haven't seen the kind of value that they do promise. So what do we do? Well, the game really changed for Webtools back not long after lockdown, when Jeff Sayer, who at the time had just purchased or acquired Medtech, came and talked to us about his vision for what's now become the Alex platform, and really decoupling the patient portal or the data layer from the practice management system as well itself, and providing a layer upon which third parties like Webtools or anyone else out there, if they meet the certain standards in terms of privacy and security, can connect in under certain conditions with the relevant contracts and permissions connect into this integration layer and interact with the information that's in the practice management system. So we started on that journey back at the end of 2020 it was, so not long after lockdown. We worked with Medtech and actually helped them in standing up their Alex layer and being the first third party to connect in and start to consume those APIs. And that was a pretty exciting opportunity. From there, we actually built, I got in touch with the team at Better Health, who I've known for about 15 years, and said, this is the kind of stuff we're doing. Would you be interested in teaming up and seeing where we can take this? So we did that throughout 2021. And we released our very first version of the Centrik app, which was branded under the Better Health Group's Better Health Outcomes app brand, which is at the top here. I don't know if you can see my mouse, but the middle app at the top. So we launched that at the end of 2021. And then in January 2022, we were introduced to the lovely team at Green Cross Health. And from there, we kind of built that relationship out, and I'll talk a little bit about more about that in the subsequent slides. But the beauty of this setup, though, if you have a look, we've got Centrik in the middle. That's our platform, and that allows us to connect in using the HL7 fire standards into on the left-hand side here. We've got Medtech's Alex application layer exchange. It's their API layer, and that connects both into Medtech 32 or as well as Medtech Evo. But given that we're building this to an international standard, being that HL7 Fire, Medtech and Alex is one example or one use case of a source data set that we can connect into. They have other use cases on the right-hand side around My Health Account at the national level or the medications data repository. The way in which we built this allows us to not only connect into Medtech via Alex, but connect into any other source data system that stands up an API and makes that available to third parties like ourselves. So we're fortunate enough to have a good relationship with Te Whatu Ora, and we've now got our connection into the medications data repository. So it's another use case to be able to augment the existing offering with our patient app with dispense medications and starting to work through the use cases of that. At the top, you can see we've got our Well app brand as well. So this is our own in-house brand. We have the Doctors app, which is the second one along. Better Health Outcomes I've touched on. We have two other use cases here as well, and a third that I haven't included. So these are all built on, we've got Maya, which is for access home-based support services, and this is effectively a marketplace for services that are available to clients or patients of access. And the house, so the Heartbeat brand, which is for the insurance industry and allowing policyholders to consume their international patient summary and share that with the insurance provider in the event of a claim that requires that information. So you can see we have a platform. There's a bunch of apps that we can build on top of that. And you can see here, so this is an example of the Doctors app. So we use modern tech and design. It's all standards based, built on the single platform as Centrik. It's white labeled, so we can stand up specific branded apps, all built on the same platform, all on that same what we call a single instance multi-tenant configuration. So it's a single code base, and Green Cross Health with the Doctors app have a tenancy within that code base, and we've branded that the Doctors for them. And it's providing an exceptional experience for our patient populations. We have a little quote here from Mari from the Doctors Whakatipu around having the positive response they've had from patients, and that's really, I mean, that's why we do this, is so that we can provide this exceptional experience. Partnering with Green Cross, so we built the apps, we partnered up with Green Cross, and the first thing we did with them was to actually kick off in our meet and greet, was to make sure that we aligned on our values and vision, what we wanted to achieve and why we wanted to achieve it. And we worked out pretty quickly that we were all in this for the same reasons. And we saw the opportunity to team up and actually really make a difference at scale across the network. We went into trial with them. So this was 2021. We kicked off a trial in about April across a range of practices in their network. So this was large practices, 20,000 patients, high portal adoption, after hours care, to small practice with no patient portal and a couple of in between. Part of that trial was us actually implementing the app, understanding how it fit the needs of that practice, both listening to the feedback from their experiences with the app, but not just listening to what they were saying, but actually hearing it and really truly understanding what they needed, and then backing that up with delivery. There's one thing listening and hearing, but if you're listening and hearing and not acting on that, then there's no point, and that just degrades trust. So the way in which we build our product, we release new product every 2 weeks. So that allows us to take feedback, turn it around really quickly, and deliver a real result out to our user base. So that built us trust, got a positive result at the trial sites. We delivered it quickly and we had a great time along the way. And then towards the end of last year, we signed a full contract with Green Cross to as their innovation partner and to roll the Doctors app out across their network. So here's where we've got to so far. So we're at 7 practices across the network, and we've got a pretty ambitious rollout strategy for this year. We've got 90 users now. 90 users being the web console users, so that's users from within a general practice. And we have 10,000 patients now registered with the app as well. So patient registration being patient-driven. That's not requiring any input from the practice themselves. That's all the patients themselves downloading the app, filling out the registration process or completing the registration process and connecting themselves in. We've also built a video consult platform to replace what Green Cross Health were using for their house call service. So that video consult offering went live with House Call in the 1st of February this year. It was actually completed in production in December, but choosing wisely not to change over and implement a brand new system just before Christmas. But the video consult offering has now been rolled into the app offering as well. So now at a practice level, you can configure an individual practitioner to be available to book with face-to-face, or if they choose to and have the technology there with the video and the microphone set up to also have a video consult offering. So here's our ambitious rollout strategy across their network. We're rolling it out in partnership, or in parallel actually, with the Green Cross Health's upgrade process for moving from Medtech 32 to Evolution. So they've got a rollout plan there, and we're coattailing that to make sure that as part of that upgrade, they're also getting the new Doctors app. As part of this rollout, it's not just the rollout itself, but how do we actually operate as a team? There are a few parts to this. On the left-hand side here, you'll see what we're calling the Centrik Co-Design Club. We kicked this off towards the end of last year. We had an informal process in place, but what we've done is kind of formalize how we engage with our providers. So as part of subscribing to Centrik, you not only get the app or the product as a service, but you also get pulled into our team and become part of the software development team, or invited to at least. So the Centrik Co-Design Club, what we do here is we send out a bulletin every fortnight to all of our subscribers, and in that bulletin we provide details about what are the features that we are currently scoping to build, and what are the scope of those features. We also include the features that we have scoped and design, and what the design of those features look like. So it gives kind of full transparency of what we're thinking of developing for the next subsequent product releases. And then every other week we have what we call the feedback session. So it's a drop-in video session during a lunch break on a Thursday, and any of the subscribers can come along and give us feedback in person to the content of that Co-Design Club bulletin. We thought that would be a great idea, that would give providers the opportunity to provide feedback and feel heard, and then we can back that up with delivery. One of the unintended benefits of this, which we didn't actually anticipate up front, was that it gives the opportunity for the providers themselves to meet each other. So we've got the likes of Dr. Steph Taylor, the clinical director at Green Cross Health, and practice managers down at rural Canterbury, CEO at Queenstown Medical Centre, all coming and joining into a single call to provide feedback on the content of the bulletin. And what that does is really showcases the variation in which practices are operating, and gets them to kind of talk about how they operate and why they operate. And what that does for us is provides us the full context to really develop a solution that is really fit for purpose. It allows us to identify when something needs to be configurable at a practice level versus when we can standardize an approach and roll that out across multiple practices. And it's been a really amazing experience kind of seeing that grow over the last 6 months. We have a product update because we're delivering product every 2 weeks. We need to back that up with telling you what we're building and what we're delivering and what's in there. And as part of that product update, we also update our training academy. So there's no point in sending out new releases with new functionality if you're not actually sure how to use it. So we have the kind of full end-to-end service there. We're also connecting things up. So because of the way we built this, it's standards based, it's interoperable. We're using the FHIR API connections to connect into Alex. What it also allows us to do is to connect into other systems. And it also allows us, the way in which we've built the web consoles, to establish individual teams that can then connect into a practice or multiple practices, depending on how you configure it, to allow a provider there to do an NHI lookup and a facility lookup and return the patient's health summary with the patient's permission. So that starts to open up a truly patient-centered model of care, where it's not just an interaction between a patient and the general practice or the general practice team. It's an interaction between a patient and their healthcare provider. So that's where I get really excited about this. So the technology is there now. We've built the system to allow that. What we need to now establish is the clinical use cases, the operational models, the funding models, and that's why these partnerships are so important, is to start to trial these things out and learn what is the best way to operate that's going to benefit both the patients and the providers. There's a few slides here. I think I've probably done enough talking, but this is just a few examples of the way in which we connect things up here. This is our web console. You can see on the left-hand side here, there are multiple teams set up within that tenant. On the top right-hand, you can add a new team here, so you've got the configurability in the web console. But you can also, when you're looking at it within an individual team here, being on the left, you can see Access Nurse Care at the top, a little bit grayed out, and under the Patients tab, we can do a patient lookup. And here, what's Jeff say? Funny that. You can see we've entered an NHI, entered a facility, return back the patient information to confirm for you that this is the patient whose information you want to return. And then we can return the patient health summary, the international patient summary of that patient as it would present to the patient in the app. So it has all the lab results and measurements, consultation notes if they're enabled by the practice, details around medical warnings, immunizations, conditions and medications. So it's the full record there. How we've also configured is when those patients are added or looked up and connected to by those service providers, they also appear in the app, and that allows a patient both visibility of who has connected to their record, but it also provides them visibility of when they last connected, as well as a toggle there to toggle off that permission. So you can see at the top there, house call, we've got that toggled on. The house call practitioner will be able to see that patient summary information, but the household assistant below that's toggled off, so their permissions will be revoked. So it kind of gives you the vision of what this could look like around a truly patient-centered model of care. And as I said here, there's a bunch of things we need to work out there in partnership around not the technology as such now, but all of these other details to see how we can take this technology to support these new models of working. So that's a massive monologue from me. Does anyone have any questions before we kick into to Kirsty's experiences? Obviously, we can have a bunch of questions at the end as well. No, thank you. It's radio silence. Either everyone's on mute or no one's got any questions. Kirsty, can I hand over to you? Oh, yeah, big smiling face there.
All right. Sorry about the tech issues a little bit earlier. Apparently my internal system doesn't like to hear anybody. So we started with the new doctor's app about 8 weeks ago, and we've learned a bit, and we've also had some quite big successes. So I thought I'd take you through our entire journey. Some of you will have heard this at the Green Cross conference. Apologies, you can mute me, that's fine. So we started out 10 months ago on a locally hosted Medtech 32 server with very low resource, and we had just terrible trouble. It took 10 minutes on average to make an appointment for a patient over the phone because of the speed of our network. We missed about 22% of our calls. We didn't have online bookings because our Manage My Health wasn't working. And the number of complaints I fielded daily was phenomenal. It was probably close to 30% of my job was responding to people who couldn't get through. So we made a couple of changes. We started by changing to a cloud-hosted Evolution instance, which was amazing for us. We didn't know ourselves from that point onward. We also had a bit of a change in our phone system. So our phone system is also cloud-hosted. And as you can see there, in phase 1, our average call length dropped from 10 minutes to 2. What did that mean? It meant we missed less calls. We were able to accept more calls. We were getting quite a lot of them, but we were able to accept them. We still didn't have online bookings, but I was getting less complaints. And then along came Al and the doctor's app. And we implemented that. And within the first, I think it was 3.5 weeks, we had 10% of our patients registered on the app, which doesn't sound like much until you consider that we've got close to 20,000 of them. So that meant call lengths were still low. We were missing less calls again, but our call numbers dropped. So the missed calls tend to be that very early in the morning, everybody's calling in to get an appointment kind of thing. So we just can't staff for that. We've now got online appointment bookings. We get repeat script requests, and I've had no customer complaints, no real customer complaints about our responsiveness. The odd interesting one, but nothing that was demonstrably real that the patient actually had waited. So that was great, but how did we get there? Can I click through this, or is that just you?
I'm trying to, there we go.
Okay, so how did we do it? How did we make it work for our team? The first thing was to communicate. So our team planned together, what were we going to do and how were we going to do it? The first thing the receptionist asked me was, can we not send our communications out on a Monday? Because all of those Monday morning communications lead to many, many Monday morning phone calls, and that's our busiest time. So we moved that to a Tuesday, no problem. Once everybody knew what we were looking at and we'd had a chance to internally have a look at what was going to happen, then we tested. And to do that, we got some of our patients and asked them to have a go. And I started our very first patients to test it were here with a massive complaint. And I talked to them about why that had happened. And it was mostly a communication thing. They couldn't get through. And I said to them, hey, look, we've got this new tool. Do you want to have a go? They took it away. They have gone from detractors to promoters. They're telling their friends about it. They're telling other people in the waiting room about it. I heard them the other day. So such a small, seemingly small thing that meant that they could have control was massive for us. Our internal comms team at Green Cross did a wonderful job. They have sent all the emails for us. If you haven't got one of those, get one. Internal comms team, we like them. So I didn't check the numbers this afternoon, but last week we were up to about 17% of our patient population registered with the app, which is huge. I couldn't be happier with it. As far as what else we noticed, very little. We've turned off Manage My Health. We've had one patient say to us, I can't request a script anymore. And we pointed out that actually we had communicated with them through Manage My Health and by email, and that it had been turned off. But the level of effort for the internal team to get a patient signed up is, well, it's nothing. The patient does it themselves. We have QR codes around, people can scan the QR code, it takes them to the right place, it makes it really, really simple. And that releases a lot of time. When your staff are not having to get the patient to sign up for Manage My Health, get their ID, get them to fill in a form that you sign and scan into their thing, send them a code that's really complex that they get wrong when they enter it in. All of those steps are gone. Since we've had it, I've had 2 patients come back to me now and say, I can't get it to work. Turned out one of them was still trying to sign up for Manage My Health, so that was easy. But realistically, we're talking about but not particularly IT savvy patient who didn't really know how to use their phone. So we got that sorted. What would we do differently? Do it sooner. I was a little bit reluctant. I wish we'd done it the second it came out. I would have been happily now a first adopter. And the feedback, both internally and externally from our patients, has been phenomenal. No complaints about it at all. There's a couple of little things that took a little while to come through from Webtools, and they're now mostly resolved. I think you're still working on the script request, being able to sort of quickly tick things off and have them go through. But we know that Al and the team know, and the team at Medtech know, that this is what we need. So, you know, we'll wait. And yeah, that was our experience, basically. It was easy. Oh, good question about that. I'm just looking at the questions. I might as well answer that one. So the
oh, yeah. Sorry, I didn't even see those. Sorry if I've missed someone.
So is there an audio issue? Probably from me. Does the QR code work if the patient is a casual patient? We allow our casual patients to sign up for it. I wouldn't say that there's many of them that have, but it's hard to tell. But we do both enrolled and walk-ins. And I think I've lost my audio. Can you still hear me?
No, I can still hear you. Yeah, it's all good.
Okay, cool. Yeah, so we allow both, but there is a setting that I'm sure Al can show you on the screen that allows you to say, no, just registered patients. That's in, isn't it, Al?
Yeah.
We do have a hand raised from Priyandra, I believe it is.
Priyandra, yes, hi.
Yeah. There we
is
go.
Is it okay to talk now, is it?
Oh,
yeah,
please.
I think so.
Yeah, go ahead.
Yeah. This looks like a good program. So it's essentially a direct replacement for Manage My Health, from the way I see it, for my particular practice.
Yes. So yeah, if you think about the way in which we built the technology, the technology isn't built as a one-to-one relationship between a patient and a practice. The use case right now for us and where we're targeting our efforts right now is for a patient to be able to interact with their general practice team, because we've got demand for modern technology and a simple, easy user experience, and that's what we're delivering here. Okay. But that's just the beginning. It's not just about that one-to-one relationship. It's much larger than that. It's about a patient themselves to be able to interact with their broader healthcare team, and also for those healthcare teams, healthcare providers to be able to interact with each other as well.
Okay, just using Manage My Health at the moment, Al. It's an awful experience. We've updated all our computers, got the latest and greatest server that works. But using the third-party applications with Medtech Evolution, or even Medtech 32, I assume, is a painful experience because it's just so slow. So I'm not too sure whether or not the Webtools app is the same, or is it going to be different? Should Medtech be looking at things that third-party applications use in terms of what type of server they provide, etc., so that the speed improves for us? Often what happens with Manage My Health, I think they also do the specialist referral things. I can go make a cup of tea and come back and then have the specialist referral thing finally open up so I can do a referral. Is that going to be my experience with Webtools? Is it any different?
With the app, no. Well, I mean, we're not integrating directly into 32 or into Evo. We're integrating into Alex, and we've not encountered any experiences with poor performance. We monitor that very closely, and we've not had any feedback from any of the providers that are subscribed, any issues with regards to app performance. I don't know if you can comment, Kirsty, but we do monitor this, and so far so good.
So Alex stays on the palette, does it? Sorry, just a quick question, or is it a separate tab that I have to open?
No, it comes in. So our repeat script requests, they come into the provider inbox, and they've got their own folder, so they're easy to find. We have turned off messaging at the moment, just simply because it became completely unwieldy, just with patients expecting that we would answer those messages and they could have a whole consult for nothing at exactly the time that they sent the message, and they were getting a bit grumpy when it takes a couple of days to respond to those. But because it's not actually sort of sitting on the desktop, it's not sitting within our local network, we aren't having problems with speed. Yeah, it's a piece of cake. It doesn't, so the Manage My Health specialist referrals are different to the app and the portal. You'll still have the Manage My Health referrals for a wee while, I imagine, Al.
Yeah, I think I'm going to be doing beta testing for the specialist referral one shortly. I think we're about to start something else there. So in terms of cost to the practice, how different is it from Manage My Health to Webtools? Al?
Well, I'm not sure the Manage My Health pricing, but our pricing's $1 per patient, or per ESU, enrolled service user per annum. And that's for and that's the base offering. It's additional for the video consults. If you want to enable that, that's kind of an extra subscription. But I can send you through all the details for that to anyone who's interested. How we encourage practices to operate if they're actually interested in this is step one is to make sure that you've got a connection between your Medtech PMS and Alex. So that's making sure that's enabled. A lot of the practices out there are enabled already for various reasons. Some are not. So we confirm whether you're connected. And that's a really simple process for Medtech to get that turned on. And the second is a contract between us and the practice. So that includes an open-ended trial phase that you can run in parallel with any of your existing portal offerings or portal products that you might be using. So you don't have to turn one off and turn ours on, or there's no migration between the two or anything like that. You can just simply get connected to Alex, sign a contract with us. We connect Centrik into Alex. Then you can download the apps for yourself and trial it from a patient point of view, and we connect you up into our web console as well, and trial it from the practitioner point of view. So you can trial that for as long as you choose to. It's not until you actually decide, yes, we want to go live with this. And as part of the go live, we have a whole marketing campaign, because at that point when you're trialing it, you're actually live in production. There's no production release required. You're live there, you're connected. You may be trialing with your own record. You may trial with a handful of patients or a group of patients within your practice, or you might use your own record, or you might trial some dummy patient records, Mickey Mouses, or whomever you have in your PMS. So you can test that whole end-to-end experience. If you're happy with that, then to launch, it's literally a marketing campaign. We've got all the collateral there and the mechanisms to do that, where you send an email out approximately a week before you want to launch, saying this is coming, this is why, this is who we are. what we're doing. Then on the launch day, we send a launch email that includes an invite code, and it's that invite code that allows, when you're downloading from the App Store, the first step is create your account. First thing they ask is your invite code, and that invite code connects the patient with the correct practice. And then it goes through the registration process. So that is the kicking off of that marketing campaign. That is when we start off the license fee. So up until that point, if you decide you don't want to, there's no cancellation, there's no penalties or no obligation. We just turn it off.
Okay.
Quick question from Mary, because it's a good question. Is allowing patients to access their children's records through the app? Now, at the moment, we don't.
Correct. Yeah, not at the moment. One of the things we do though, well, there's two parts to this. One, to explain it from a feature roadmap point of view, we're really transparent about what we're building and when we're building it. So we have a partner-facing roadmap. So we have a bunch of platform stuff, which is all integrations and stuff, which is probably not relevant to the average user. But we have a partner feature roadmap, which specifies for, on a kind of quarter-by-quarter basis, what are the features that we're committing to delivering. And this whole area around accessing dependents, so it might be children, but it could be anyone whom you're providing care for. We've got that functionality scheduled for Q4, I think it is this year. Q3 or Q4 this year. So it's on our roadmap to deliver, and we publish that roadmap and we stick to the roadmap. So the other part is around.
We have another question.
Sorry, just to finish that one off because it was two parts. Was the reason for appointment. So we've introduced reason for appointments as part of the appointment booking flow. So you can actually enter. It's an example. I'm booking on behalf of my child, so it allows the reception staff when they're receiving that to make those changes if they need to.
We also have another question. Do you keep patients' records in the Centrik platform?
Absolutely not. No. So that's the beauty of this whole the kind of ecosystem and how things integrate. So what we do with the app is like literally we are the Centrik is the conduit through Alex into the practice management system, and the patient on demand. So it does a swipe down to refresh, repopulates the information on their app, and that's on their app only. We are just literally the conduit through which the information is passed. It is cached locally on the patient's device, so that if the internet goes down, they can still see their records, but it's on their device, and that device is part of a multi-factor authentication, so that when they register for the app, they have to register both themselves and that device. So, but we store no information from the patient's record. The only information we do store are the app registration details, so that's the first name, surname, date of birth, and mobile number, and that's as part of we register the account, and then that account then creates the connection through into Medtech through Alex.
Is anybody on this chat that has converted from, had significant uptake with Manage My Health who have moved over to Webtools? Perhaps they can give us their experience. Admittedly,
That's
the
us.
practice but did you have a high uptake with Manage My Health initially, though? It wasn't mentioned.
Yes, we did. So okay. I think we had over 10% of our patients were registered, but they weren't using it. They were registered, but they weren't using it.
Okay.
Now they're registered and they're using it.
Okay. Yeah, on that, actually, one of the interesting things I haven't touched on is part of the email invite campaign. We have included an invite for patients to join our consumer group, and that consumer group that gives us permission to contact the patients who sign up. And we've done a whole bunch of interviews with patients and seek feedback from them regularly. And one of the very first things we wanted to understand was the existing experience with the patient tech, the mobile tech, and some of the barriers to adoption. And the very first barrier was can't get into the bloody thing. And just literally we're having challenges actually getting into their accounts. So we've introduced what's commonplace now in modern tech, which is all the biometrics with face recognition and thumbprint and backup pin and that kind of stuff. And I can take you through a demo of all that, but we actually have a demo video and stuff I can share after the call. But I'm happy to take anyone through the app now if they're interested, or whether the Q&A is a better use of the time. It's entirely up to you guys.
do have a few more questions in here. Will the doctor's app have an e-prescription dispense record?
An e-prescription dispense record. That's interesting. So we've literally just, probably it was about 2 weeks ago, gone through the process of becoming one of the early adopters for the medications data repository. So that allows us to get access to what they call at a national level is the medications consumer view, which is around the dispensed medications from that national data source. So what we'll be working on with Green Cross Health as a partner, and anyone else who might be interested in this, is what does that look like when we have access to that information? Like we, as in the technology is there and the information is accessible, but what gets presented to whom and for what purpose, and what do we want to do when you've got both a prescribed and a dispense record? Does that trigger any action if it's been prescribed and it hasn't been dispensed, or it's all of that kind of workflow? So again, that's not a technology challenge; it's more of an operational and clinical kind of workflow, as well as privacy and what is the funding model that kind of underpins all of that as well. Hopefully that answers the question. That's scheduled Q4 this year, the pharmacy dispense stuff.
Okay, so Cherie asked about access through a website for those who don't have a cell phone.
Yeah, so that's actually scheduled for this quarter. So we were mobile first because the highest use cases for when we start off with Better Health, it was like, right, we've got the app, let's like, how do we start to prioritize these features? So we do prioritize delivery of the features and that feature roadmap, working with our partners, and the unanimous feedback we got was, let's get the app up and running so that we've got all of the high volume requests, like the booking appointments and ordering repeat prescriptions and ability to message and consume your own information around laboratory results. Let's get that all done and humming first. And then let's roll out a web equivalent. And the beauty of the technology we've used to build Centrik, and the app specifically, it's a platform called Flutter. So what it allows us to do is code it once, so build one product, allows us to deploy it out to iOS devices and Android devices using the same code base. So you don't have to build two separate apps, which is quite commonplace out there. But it's also come out with a new version last year, which was to allow us to both deploy iOS, Android, and to the web. So we did a very first version of the web portal, which is 100% feature parity because it's the same code base. So every feature you get in the app, you'll get in the web portal. The challenge was when you're building these things, you use these things, in the tech language, you use these things called libraries. And some of the libraries we were using for the mobile app weren't compatible with the web version. So we're working through the process of just finishing off the final library transfer to make sure that they're working across platforms. And then we'll be releasing that this quarter.
Mary, I can answer your question about multiple accounts or apps be registered to one phone. I can only register mine on my device.
Yeah, it's one to one.
Can I just confirm, when we do get the requests coming in, does it go into your provider inbox, or is there a separate inbox? So it's mixed up with your results, etc. Is it? Your lab results.
Yeah.
Requests for what are you talking specifically?
When a patient requests prescriptions, for example, is it together with the rest of the stuff that you get from the lab and in the provider inbox, or is it? Can you pull that up as a separate tab?
It's in the provider inbox, but it's got its own folder. Down the side you've got lab and scan and RSD. It's got its own folder. Okay.
And on that's the current version. So one of the things we talked about earlier was the partnership across Green Cross and Webtools, but also Medtech. And we worked closely with them last year around the whole medications or repeat prescription and request workflow. And we actually took it right back. And so as a result, the current version, the way in which Centrik works is through into that inbox. But what Medtech have done is released with the new Evo 6.2 is a whole new medication request workflow within Medtech. that allows a really easy identifying when those requests come in and multiple select or decline on that. And then they've subsequently released that, because if you think about the system, you've got the PMS and you make a change and you release that version. Anything that relates to the integration, you've actually got to release a separate Alex version. So they've done that as well. And so this quarter that's one of the top priorities of the web portal and repeat prescriptions workflow refinement is to pull that new workflow into our request process. So instead of the request going into the repeat prescription inbox or folder, for those using Evo, will go into the new medications request area, so that that workflow is becomes super slick from a provider point of view. Oh, here we go. I've got more questions here.
There's a bunch of them for you, Al.
Okay, shall I just run through these myself? Shall I? Where are we up to? Okay, thanks for answering the question. I've been following these. If Centrik collects data via the APIs, how to ensure all data is up to date without lags? So you can see, I mean, it's on demand, so you can see when it was last updated. Pull down to refresh. You can see on the maybe on the screenshot. I'm still sharing my screen, aren't I? So you can see on the far left hand there's an app image. You can see updated just now under order repeat prescriptions. That time will tick on and on and on until you pull down and refresh. So it could be updated 2 days ago. But if you just do a simple swipe down, that will go and make an API call, return the most recent information on demand. Okay, we've answered, is access via the app and browser. Can clinicians operate the app from within the Medtech system? I suppose the short answer is no, because there's the patient app side of things, and then there's the web portal. The web portal has it's probably mostly hands off for the general practice team. There's sort of configuration there around what practitioners you make available and how they whether they're available for video consults and the like. There's the messaging element to that. But the things like the repeat prescriptions workflow just integrate directly into Medtech. The appointment requests integrates directly into Medtech. So there's very little for the patients or the provider, sorry, to actually do within the web console. Are you going to connect to My Health account? Oh, that's a really good question. There's kind of a few moving parts there. We had initial conversations with Te Whatu Ora at the end of last year around My Health account. It was actually mid last year, I think, and they had scheduled us in to as one of the kind of the early adopters for My Health account. But since then, there's been quite a lot of change, obviously, at Te Whatu Ora end, as well as some work at the Medtech end and conversations at Medtech around them also integrating with My Health account. So right now we're not, and we're keeping a close tabs on actually when would be the right time to do that, if it's the right thing to do. It might be that we actually integrate through My Health into My Health account, but actually through Alex. So we'll just wait and see there. Is the app available for patients who do have a New Zealand account? Your patients who is placed to account. Yes. Yes, you can. It's not locked down to New Zealand. Yes, is the short answer. I think I've answered that correctly. Kirsty, how do you make sure payment is generated for prescriptions that go straight into the doctor's inbox?
Basically, I make them do it. So we do keep an eye on that inbox, and so we just check. Because I can filter in Evolution, I can filter very easily for all providers, and for that folder, I can see when a prescription has been either accepted or declined, and then we just, when you're daily checking, just check the two against each other. The
I don't know if
other
you guys
question that Angela asked,
sorry, I just wanted to jump in there.
Right,
all right, okay, you carry on there, and then I'll go roll back to the payment stuff.
Yeah, we're using Meteor as well. Sorry, so it's really easy to do the invoice. Click the patient the link, and then they pay.
Yeah, and so we're in the design phase for the Meteor integration as well via the app. So there's obviously a request from multiple providers around being able to pay for that repeat prescription as part of the request process. And we're in the design phase this quarter, and then we'll be kicking off the build of that come 1 July.
Yeah, that'd be good. And Angela also had a question around what information does a patient have to provide to sign up so that nobody can access somebody else's information. So Al, that's for you.
Yeah, so that's it has to be 100% match on surname, date of birth, and mobile number. And that mobile number being so when the patient registers, that 100% match has to match the information in the patient register in the PMS. And as part of that, you've got a MFA code that goes back to that device as well. So if you've got the right mobile number, you have to prove with that MFA code that it is the device you've actually got as well. And I suppose that's really the only challenges there have been, not challenges, but connection issues tends to be when a patient enters their details, and it doesn't allow them to connect, in which case they need to make a telephone call and they're prompted, and you've got the number there on the app as part of the registration process, but to confirm the details with the practice. And it's often a case of where the details in the practice for the mobile number are out of date. They've changed their mobile number, so that's all managed at the practice end.
Or a surname with a hyphen.
Oh, yeah, strange spelling of surnames. That's right. Oh, not strange, but different spelling of surnames.
Yes, yeah. So it's almost impossible, Ange, to sign up for somebody else, because if we've got their mobile number, the patient's mobile number, and somebody else attempts to sign in or sign up, even if they know that mobile number, the authentication is going to go back to the other mobile, to the owner's, to the patient's mobile, rather than to the person who's being a bit nefarious.
I can see here, next question. I'm just making sure I've got these in the right order. That was a security. How do patients register? Okay, so that's a simple registration process. You scan the QR code or do the search on the App Store. Step one is enter the invite code that you'll be given from your practice, and then the remaining steps is very much like signing up to Uber Eats or any other kind of the modern tech. Is like it just takes you through a workflow, which is the bare minimum to actually give us the registration details we need to be able to connect. It also includes enabling the MFA and that with the invite code the text code coming back, as well as the biometrics. But it's super simple. We made a lot of revisions to that. The very first version of the registration was kind of a scroll down, thinking that the fewer clicks or the fewer swipes, the better. But that actually comes with a whole cognitive load and thinking I've got to fill out all of these different fields. So actually having a really restricted number of fields like email address, then swipe, first name, surname, swipe, date of birth, swipe, mobile number, job done, basically. And that makes it super simple for the patients. Can the messaging support photos? Right now, messaging doesn't support photos, but we have documents, which does support photos. So documents was our very first version where you could scan or take a photo or a file and upload. That's to have it available on the app for yourself, as well as via the web portal. Then since then, we've introduced messaging. So right now, we actually have a design challenge to work together with the partners around where do we actually incorporate this part of the puzzle. Do we keep them as separate features? Do we incorporate them into a single feature set? And that's to be determined. Pricing for video consults, so that's $30 per seat per month. So when I say per seat, so per user enabled for it, and $1 per consult. And that's not charged for the call. $1 per call, but it's unrestricted duration for that. Can multiple patients use the same number? No, they can't. And what will be the best option for the practice to request patients to upload documents from the app? I see what you mean. So I think, is it this quarter, Bridget, that we've got so right now we've got messaging version 1, and that is patient to practice messaging. Version 2 is practice to patient initiated messaging. And there's a bunch of things we want to consider around there is, messaging individual users, messaging particular patient cohorts, messaging for recalls and what are the triggers for those sort of things. And that's a co-design process we'll be kicking into shortly. So right now, there is no direct messaging practice to patient, although that's what we're working on currently. And I think, how are we doing for time? Oh, we've just gone over.
Just gone over.
I'm happy to kick on if anyone else is interested. I've also can send off. I'll send off my contact details. We've got a little product demo video as well. If you're interested in details how on our various websites, you can find out a bit more if any of this is of interest to you.
Okay. Did we have any last questions or anything else coming from the team?
Yeah, was there any in that list that I missed? Just have a quick check through that. I think we covered them off. I think that could be us.
Look at us go.
This is about as close to time as we could have asked for. All right.
I would like to put a big thanks out to you all for attending. I know time is very valuable, and time when you're in primary care is particularly valuable. So I do really appreciate you taking the time to listen. If you have any questions, please don't hesitate to get in touch with myself and Kirsty as well. I'll make sure we share our contact details. But really appreciate the opportunity to showcase what we're doing. I love it. I love working with the Green Cross team and our other partners, and actually making a difference in this space. So if you'd like to team up with us, then don't hesitate to get in touch.
All right. Fantastic. Well, thank you all for attending. Thank you so much to our panelists for chatting. That's really been very useful. And we'll make sure that we get any side questions, any questions that might crop up in the middle of the night. Please feel free to reach out to myself, to Al, to Kirsty, whomever, get those questions answered. I know I always come up with questions only after I've been asked. So, all right. Thank you so much for your time. Have a good one.
All right. Thank you, everyone.
See ya.
Take care.
See you, everyone.